Good afternoon, everyone, and welcome to our media briefing. Last week, we mentioned our plan to form a safe reopening compliance team to ensure businesses, establishments, and people across the region are complying with our public health orders and helping to slow the spread of the virus. We are still working on the details of that because this effort would involve all the cities in the region. It's taking a little bit more time to work out some of these details, but we do expect to have a plan presented at our Tuesday Board of Supervisors meeting. I want to be clear, however, that this would be in addition to our current enforcement efforts. For example, we are already following up on egregious cases or violations of our public health order, and as you know, we have been forced to take action against some businesses. Meanwhile, our Department of Environmental Health has been following up on outbreaks at restaurants. Outbreaks that don't involve restaurants are being investigated, but we are looking at transferring code compliance officers and maybe supplementing them with temporary staff to boost our efforts in this effort. In terms of cases and tracing, it's not lost on us that a significant issue is the large number of cases in the Latino community. One of the measures we are looking at is making sure that as we beef up our contact tracing teams, we add a significant number of Spanish-speaking and Latinos to the teams to ensure that they represent the communities that are being hit hardest, and also that our T3 program is connected in a culturally competent manner. For more on all of this, let me call on Supervisor Fletcher to go over this information and the numbers.
Thank you, Chairman Cox, and good afternoon. We are continually monitoring, adjusting, making refinements and changes to what we're doing. The nature of the coronavirus pandemic requires us to daily question our actions, to daily look for areas where we need to improve and do more, and we will continue to do that as we have from the outset. We know that the overarching aim is a broad-scale community one where we're all focused on slowing the spread. The individual actions that we all take, utilizing face coverings, avoiding large, particularly indoor crowds, physical distancing from non-household members, these are the things that if we can come together and do as a community, allow us to get more of our businesses open, allow us to begin to have conversations about safely reopening schools, and so we remain focused as a community on lowering those numbers. But I want to talk to you specifically about a handful of things that we are doing as a county to continue to work in adjusting our efforts around our direct response for what's happening. We are making an update to our public health order today regarding the employer responsibility when it comes to notifying their employees of an outbreak at their entity. We currently provide recommended guidance for entities where an outbreak has occurred, and we recommend that they notify their employees that there has been an outbreak. We additionally provide language that they can put on their letterhead to share with their employees in an effort to make them do that. And we believe that most entities are acting responsibly and notifying their employees. But with the growing number of outbreaks we're seeing, we are going to go the extra step to ensure that employees are notified if there was an outbreak and by their employer. Section 16 of our public health order will be updated to make sure that entities shall notify employees of an outbreak that occurred at a physical location where they work. The standard course of action in this situation will be case investigators will be in contact with the employer surrounding the outbreak. They will talk to any employees who are positive. Any close contacts will be notified by one of our contact tracers and given quarantine instructions. But in addition to this, we want to make sure that employers are notifying every employee at that physical location, even if they were not a close contact, that there has been an outbreak at their place of employment, and give them instructions about steps and things that they should take. That order will go into effect at midnight tonight, and so that will be in effect starting tomorrow. And we will communicate that with all employers as a part of our outbreak investigation and our case investigation process. In addition, as Supervisor Cox mentioned, We've worked very hard to increase testing and tracing in particular, bringing on more employees and doing things to ramp up these efforts. We've also been mindful that it is important that those efforts be focused proportionally to where the impact of COVID is happening most. And so we try to do that by redirecting our testing, the prioritization and focus of our testing into those communities, particularly in the south part of the county and the Latino community, to ensure there's more testing there. As we've brought on an exceedingly larger number of contact tracers in an effort to keep up with the new cases, we have had a very diverse workforce of individuals who've come in. But COVID is not impacting the population at the demographics of population. We know there is a disproportionate impact of COVID, particularly in the Latino community. And so our aim and effort is to have contact tracers who match not the demographics of the population, but the demographics of our positive cases. We know that we have a ways to go to fulfill this, and we are working and engaging with community groups. We are doing outreach to get more applicants, to get more Spanish speakers into the process. We're doing more work around outreach, around the importance and availability of testing and things like public health rooms, along with general information about coronavirus, and we're striving to make sure that our response is matching the communities that are being impacted. And we will continue to work to do better on a daily basis. As Supervisor Cox mentioned on enforcement, we're also making some modifications and changes to what we're doing surrounding enforcement. And I'd like to bring up 2 slides to walk you through what we are currently doing. The current compliance effort really focuses on, number 1, the egregious cases we've seen. These are willful, blatant situations of defiance of public health orders. We've issued 3 public health orders for closures. We've issued 3 cease and desist letters. In addition to those, we've had multiple instances of county staff following up, working, trying to gain compliance around these issues. We also have been investigating every outbreak at a food facility through our Department of Environmental Health, along with regular checks of 7,500 food facility locations. But the reality is we know that we need to do more in order to keep up with the increased spread. And so if we'll go to the next slide, these are the additional steps that are being taken right now. We're in the process of setting up a healthy compliance hotline and email access. This will be a shift from the current reporting that is done at 211. We want to set it up at the county so that we have an opportunity to engage with the individuals who are calling in with healthy compliance issues, to get more information and more details from them and try and assess the level of severity of the issue that's being raised. We're bringing on additional staffs to increase our ability to respond to those egregious cases, those willful, blatant violations surrounding outbreaks, pre-outbreak assessments, along with follow-up inspections. And we're working closely with the cities. The aim is that we pair a county person with a person from the jurisdiction where the complaint has arisen so that we can go out in a team and try and work to gain compliance and resolve it. In addition to this step, the Board of Supervisors on Tuesday will be considering additional measures that we could take around additional increases in staffing to gain compliance, and the board will hear a presentation from county staff along different tiers of complaints that we could have the opportunity to increase staffing to try and investigate, and the board will deliberate and make a policy decision about how much further beyond the essential public health requirements that we are presently ramping up to meet that we want to go as a county, and so stay tuned for Tuesday's board meeting. With that, let's jump into today's charts. Today we're reporting 8,456 tests as a 7-day average. Our daily numbers the last few days have been down a little bit, but this remains our 7-day average of reporting. You might note that our goal is up a little bit. It was at 6,600. We're now at 6,740. This is just in alignment with the number that the state of California projects for population for 2020, and so to be consistent with what they use, given our aim is to have 2 tests per 1,000 residents every day. Guidance from the state, we wanted to use the same numbers that they do. Also, in an effort to avoid confusion, we've on our T3 chart, we're putting the 14-day average percentage of new cases. That is just to align with the next chart, which you will see in a minute, which you've been seeing from the beginning, which is also 14 days. We're now over 580,000 total tests reported. 11% is our contact tracing or case investigation. We are working to increase this. We're onboarding new folks, and we think we will begin to see this number move up in the near future. And then our percentages of close contact traced starting within 24 hours is on par with where we expect to be. And then you can see the treatment, those in our individuals in our public health room, the total numbers along with convalescent plasma. For today's totals in cases, we're reporting 282 new positive cases, again, out of 6,899 tests. Again, you will see that the number of daily tests are lower the last few days than they have been. Some of that was an effort to realign. We talked a few weeks ago about reprioritizing and focusing our testing with a particular emphasis on the turnaround time and ensuring that we can increase our turnaround speed of testing, but we continue to be in excess of our stated goal for where we need to be. And again, in the purple line there, you can see the 14-day rolling average of percentage of positive. Moving along to our hospitalization, you will see our ICU-related COVID at 149 there, up a little bit. You see the days there, there's been some challenges with the state data system in terms of what they're reporting, some missing data they've had. We've taken efforts to try and correct it with local data, and we continue to work with the state to, along with our local hospitals, to refine that process. But 149 for ICU, 502 total COVID-related hospitalizations as of right now. On the next chart here, you can see where that 502 fits in with the non-COVID related to bring us to a total of 4,382, just a little bit up from where we were yesterday, a little bit down from where we were the day before, holding relatively stable. And then the final chart is our ICU capacity. Again, you see the COVID-related numbers in the blue, non-COVID in the yellow. Both of those are up yesterday to today at 481, which brings us to 68% of our current regional ICU bed capacity being occupied. That concludes my section of the report. I'll now turn it over to Dr. Wooten for a public health officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. Today's global, national, and state statistics are based on the data from the Johns Hopkins dashboard, and these data were obtained today at noon. Today's local statistics in San Diego County are from reports as of 11:59 yesterday. So today there is a total of 28,287 cases, which is 282 more cases than yesterday. This is a significant decrease in new cases since yesterday's report of 498 cases. The overall total number of cases includes 552 deaths. 5 new deaths were reported since yesterday. In the next slide, the age range of the cases is from 3 months to 102 years of age. For our age group from 20 to 49 years of age, this remains at 59%, represented by 16,607 cases. We have 51% female and 49% male for the overall number of cases. Also, 2,459 or 9% of cases have been hospitalized, and this includes 632 individuals that have been admitted to the ICU. This number is 2% of the total number of cases and 26% of the total number of those hospitalized. On the next slide, this reviews COVID-19 demographics related to cases that have been hospitalized. Of the 2,430 hospitalizations, the 50 and over age group represent 71%, which is the majority of those hospitalized at 1,742. Males represent 54%, which is 1,330, and Hispanics and Latinos represent the majority at 61% of those hospitalized, which is 1,398. Going to the next slide, again, regarding deaths, there were 552 total deaths, which represents 2% of the total number of cases. 243 or 44% are female, 309 or 56% were male. 527 had underlying medical conditions, and this represents 95% of those who have unfortunately died. And as always, our sincerest condolences and sympathies go out to the family and friends of the community that have lost their lives due to COVID-19. Next, I would like to bring your attention to a recent CDC morbidity and mortality weekly report that was published last Friday. It estimated how many U.S. citizens have at least one of 5 underlying medical conditions associated with worse outcomes if they contract COVID-19. And this, they included information about hospitalizations, ICU admissions, and death. Some pre-existing conditions in this report included cancer as the number 1. Number 2 was chronic obstructive pulmonary disease, commonly known as COPD. Diabetes was number 3. Heart disease was number 4. And obesity, which is defined as a body mass index equal or greater than 30. CDC estimated that across the United States, 47% of adults have at least one of these 5 underlying medical conditions. At the county level, rural counties tend to have higher proportion of adults with at least 1 in 5 underlying medical conditions. Locally, our county community health statistics unit has estimated that 57% of, or nearly 6 out of every 10 San Diegans, and these are particularly adults 18 years of age and older, have pre-existing medical conditions, including hypertension as well as obesity. These type of conditions predispose individuals to more severe COVID-19 complications if they are infected. So since the beginning of the pandemic, now we'll turn to our discussion on outbreaks. Since the beginning of the pandemic, we have had a total of 257 total outbreaks occurring across 3 categories: skilled nursing facilities, other congregate settings, and community settings. Of the 257 outbreaks, 138 or 54% are now closed and inactive outbreaks, meaning that there have been no cases in these settings for the past 14 days. This leaves 119 or 46% of the 257 outbreaks that are active. Of these, 22 or 20% are in our county's skilled nursing facilities, and there are 86 skilled nursing facilities across the county. In total, associated with this or these type settings, there have been 690 residents and 394 staff with laboratory confirmed COVID-19, and this includes 141 deaths. 33 of the 119 active outbreaks, or 28%, are in non-skilled nursing facilities or other congregate settings. All total, there have been 659 residents and 449 staff members that have been reported to be positive for COVID-19, and this includes 90 deaths. Lastly, 64 or 54% of the 119 active outbreaks are in community setting locations. Since March of the beginning of the pandemic, the total community outbreaks have resulted in 1,040 laboratory confirmed cases, which include 9 deaths. Now I will transition to our triggers. So as everyone is aware, we have 13 triggers, and on this table you see the triggers number 1, 2, and 11 are abnormal, and we will focus our efforts and discussion on those particular triggers. For trigger number 1, this is related to case rates, if you go to the next slide. And this is the state metric that has landed the county on the state's county monitoring list. This trigger represents or reflects the rate of cases per 100,000 population for a 14-day period, measured using the date of the illness the onset of illness with a 3-day lag. And currently the case rate is 139.4. This is encouraging, as you can see from the table in the 3rd column, that the number is decreasing, but it is still elevated above the 100 per 100,000 population target. And the case rate, again, as I stated, has decreased. It's slightly increased since yesterday, but still overall, it is lower than the 150s that were seen in July 22nd through July 26th. So again, this is promising. Trigger number 2 is related to community outbreaks, and this slide shows the outbreaks reported over the past 7 days. And in the past 2 days, we've seen yesterday 6 new community outbreaks, and the prior day 8. In this next slide, this basically lists the setting locations and the date that the outbreaks were confirmed, and the most recent ones, again, are listed on the second element, the second slide. So for the most recent 6, we have 1 in healthcare, 1 that is purely a restaurant, and the other 2 that are restaurant/bars, and then we have 2 businesses. In the next slide, this is related to just an overview of community outbreaks since March, and as you can see, for the month of July, we now have more than doubled the number of outbreaks that were reported in the month of June. In our next slide, we will discuss trigger number 11. Supervisor Fletcher alluded to this in his remarks. This trigger is met is 70% or less of investigations are initiated within 24 hours of notification over the past 7 days. Today's result is less than 70% and holding at 11%. This number has stayed about the same since yesterday, and we have approximately 100 new staff that started last Friday. An additional 60 will begin this Friday, and staff members are working to decrease the backlog due to this increase associated with the decrease of this metric associated with the increase of new cases. Again, the number of cases reported today will give us a bit of a reprieve. And as a reminder, we would need to have 240 or less cases per 100,000 population for 14 days. Or rather, let me repeat that. We would have to have 240 or less new cases on a daily basis for at least 14 days in order to go below the 100,000 cases per, the 100 cases per 100,000 population. So we are headed in the right direction, but we still have a ways to go before that metric changes. So in closing, getting through the pandemic requires that we all do our part. The majority of San Diegans are conducting and adhering to the health officer's orders and the directions that we've given. But we must continue to do our part, and kudos goes out to those businesses that have been responsive and innovative to implement the state's order. But continuing these efforts will require everyone to continue to adhere to the following: washing your hands and sanitizing areas, particularly in businesses that are commonly touched, staying 6 feet apart, wearing face coverings, avoiding crowds, and then staying at home if you are sick. Now, please welcome back to the podium Chairman Greg Cox. Thank you.
Okay, we'll go right to the questions. First question.
First question is Mimi Alcala with 10 News.
Hi, thank you. Yeah, earlier today I got the letter that Dr. Wooten sent to the gym in Pacific Beach for failing to close indoor operations. Can you confirm if there was a COVID-19 outbreak at that gym, and if so, when was it reported?
Okay, Dr. Wooten. The gym.
Hi, thank you for that question. We can confirm that there is an outbreak at that location, but that is the only information that we will be able to share with you. Thank you.
Thank you. And the county has sent a number of those letters to churches or businesses for failing to comply with the public health order. Have any recently received fines for continuing to operate inside despite receiving a letter from you, Dr. Rubin?
Well, when the complaints, we work in alignment with the law enforcement in the jurisdictions where the businesses are located. And law enforcement would have the data for how many different citations have been issued. So I do not have that information today.
Thank you.
Okay, we'll go to the next question.
Next question is Artie Ojeda, NBC7.
Good afternoon, everybody. I'd like to follow up more on the issue, the COVID outbreak at the gym. This gym, defied health orders for operating indoors. The gym was ordered to shut down, yet it remained open for a time. I know all of you are sincere when you say you want to educate first. I know you're working on compliance teams, hotlines, solutions that are days, however, days if not weeks away. So wouldn't an outbreak like this one at the gym underscore a need to start taking immediate and definitive action on these businesses? What is their incentive to follow the rules if there's no immediate consequence?
Okay, Dr. Wooten.
Artie, that's a great question, and when we get the information regarding outbreaks, no matter where a location or business is located, we act on that information. It's just this was a perfect storm in the fact that we had required the business to close, and then yesterday they were on our outbreak list. So last week when we were working with them to get them to close, we didn't know there was an outbreak there. So again, once we get the information, we act as quickly as possible. And I understand that there's your concern about them not closing immediately, but for some businesses, it takes a lot of actions to take place in order for them to do that. We work with them to close, and they close on Monday, and to my knowledge, they are still closed. Thank you.
If I may follow up, again, the order was sent on Thursday to immediately close. However, they remained open, and they did not, they remained open for 3 full days before shutting down. But let's move on. Let me ask you this. Would there be any consideration for harsher penalties against these egregious violators?
Well, that will probably be considered, or may be considered, in the compliance program that is being developed, and we will review what those type of fines are. But currently, any business or any entity that violates the order, it is a misdemeanor, and it is subject to a $1,000 fine. That is the current fine or that is on the books. Thank you.
Okay, we'll go to the next question.
Next question is Hunter Sowards, KUSI.
Dr. Wooten, this question kind of piggybacks on the last two, but I wanted to kind of hone in on why you feel Pacific Beach is one of the latest hotspots and continues to obviously be a problem area for some businesses. Again, really, is there something specific being done in this area that continues to see a rapid increase here, or is that being considered?
Okay, Dr. Wooten.
Yes, we are very knowledgeable and aware that Pacific Beach attracts a much younger population. And as you have heard in the daily updates, 59% of all of our new cases are in individuals that are between 20 and 49 years of age. So Pacific Beach is a hotspot for that particular age group. And there are other locations throughout the county, such as downtown or Little Italy. But locations and bars where individuals gather or congregate, those locations do attract this population, and hence, they're not social distancing, they are not wearing masks or facial coverings, and hence they increase their risk for contracting COVID-19. It really is not, it's very clear what the cause of the increased number of cases is, and it's very clear what actions and steps we need to take and have to take in order to decrease the number of new cases every day. And as we've stated before, and if staff can show that again, it really is focusing on sanitation and hygiene. It is social distancing, wearing facial coverings. Actually, I heard on a radio station yesterday that if individuals wear facial coverings, they can decrease their risk, their individual risk of contracting COVID-19 by 65%. So the science and evidence is out there of what we need to do. And obviously, if people are, in addition to social distancing and facial coverings, if people are sick, stay home. Thank you.
Will the Healthy Compliance Hotline that's in the works, will this be something that people are going to see maybe specific enforcement measures off of those tips? I mean, how is that going to work? Is it a phone call that will be made to to the business that's maybe not complying? Have we figured out how those hotline tips will be followed up?
So we will unveil the actual operations of the new process after the issue is taken to our Board of Supervisors next Tuesday, and we'll be happy to share that with you on Wednesday.
Okay, thank you, Dr. Wooten.
All right, let's move to the next question.
Next caller is Lindsay Winkley with the Union Tribune.
Hi, thank you so much for taking my question. Yesterday, the county reported 5 new outbreaks at restaurant bar locations, and today, additional outbreaks at restaurant bar locations were reported. We've been hearing from a lot of individuals in the community who are curious whether these outbreaks involve customers who were being served outdoors, or is it more common for outbreaks at restaurants, bars to involve employees?
Dr. Wooten?
Thank you for the opportunity again to clarify information about community outbreaks. If staff can show the tables, actually yesterday we reported 8 new outbreaks. If you can go back. So you see at the bottom number 11, 12, 13, and then the next page, next slide, 14 through 18. That is 8 new outbreaks in the various settings from gyms, nail salons, residents, and restaurants, bars, and businesses. And then today we are reporting 6 new community outbreaks. And as
Right,
yes,
I'm familiar with the numbers of the overall outbreaks, but I'm actually specifically concerned, or kind of asking the question about outbreaks at restaurants and bars. And you know what the question that we're repeatedly getting is, are these outbreaks involving customers who are being served outdoors, or is this something involving employees?
well, we've just transitioned to outdoors probably since approximately about 10 days ago. There's a process. Once we identify different cases at a particular business, whether it's a restaurant, bar, nail salon, wherever, then we have to call each of those individuals to gather additional information. Because COVID-19 is widespread throughout the community, they may not necessarily have been exposed at the facilities that they are reporting that they've been to, but we look at the time period, and if there is any similarity between the various individuals that are citing a specific location. And that brings us to the fact of whether or not we have an outbreak at that particular facility. So your question about outdoor, it's possible that some of these cases, since we closed down indoor dining, it's certainly possible that that could be included, but I don't have that information in front of me right now. The point of the matter is, Adhering to those strategies that I outlined earlier is the best way that we will be able to get our arms around COVID-19. And what we're trying to do is walk a fine line in a balance between public health as well as economic viability for our local businesses. And as such, we will have to be vigilant to make sure that we are conducting the case investigations and contact tracing for cases that are reported to us. And just as an aside and not related to your question, all of the cases that we report every day are new laboratory confirmed cases. They're not suspect or probable cases. They're not repeat cases. They are first time new cases that are laboratory confirmed. Thank you.
Thank you.
We'll move on to the next question.
Please state your question.
Hi, yes, thank you very much. Going back to the gyms, we had a viewer get a hold of us today and say that they were driving down University and saw one of the gyms that's involved in that lawsuit. It was jam-packed, no physically distancing, very few people wearing masks. So sort of a two-pronged question here. Is the county just completely helpless in shutting down these kind of possible super spreader events? And does the pending lawsuit prohibit you in any way from taking action against them?
Okay, Dr. Wooten.
Supervisor Fletcher will come after me as well. Lawsuits don't come into, for me, it's about adhering to our health officer's order and implementing actions that we have outlined. And as I stated earlier, you'll hear more about our compliance program. It does require that we bring on additional staff. Now I'll ask Supervisor Fletcher to come to the mic.
There's been a good faith effort to try and keep up with the egregious, blatant, willful violations, the type you're talking about. We have issued multiple public health orders. We have issued multiple cease and desist orders. We have coordinated and worked with law enforcement. But the reality is the increased number require us to increase our ability to respond to those. And so that's what we're doing by increasing our staffing to be able to go out to those locations, by refining the hotline so we can get more accurate information in more real time, and working to try and find more avenues so that we can do that, and partnering with the cities as well. And so it's a recognition that we've been doing as much enforcement as we can, but the simple reality is we have to do more. And that's why we're taking a step to increase around those egregious violations around outbreaks, particularly outbreaks that are not tied to food settings where we have been inspecting. And then we will go to our board on Tuesday with options to do even more beyond just the egregious situation and the outbreaks. And so we recognize we have to do more, and we have to step up what we're doing a little bit, and we're responding accordingly.
Thank you.
All right, next question.
Brandon Lewis, CBS 8, please ask your question.
So I wanted to follow up on some of these questions about penalties. Dr. Wooten said in response to the penalty to $1,000 to misdemeanor, and so that's what's on the book. So Supervisors Cox and Fletcher, I'm wondering if either of you think that a change is needed to stiffen the penalties given the increasing number of egregious violators.
Well, I'll respond. I think Supervisor Fletcher also think will make some additional comments, but I think we're confined under state law in regards to what the fines are. So they are what they are. $1,000 for some businesses may be just a part of the cost of business, but we hope that businesses will look at it responsibly. As community partners, the last thing they want to do is to see their customers come down with COVID-19. Now, it does raise a question, and obviously we're not providing legal advice, but it does raise a question in regards to what their insurance might say in regards to if they had their customers, their employees that came down with COVID-19 as a result of their negligent acts. But again, we're not providing legal advice. That's just an issue that I think any business should be looking at. Supervisor Fletcher, anything else?
No, again, the $1,000 fine, as Supervisor Cox said, is what's outlined by state law. It is $1,000 per day. But again, we are trying to increase our ability to do enforcement. We're trying to increase. There are literally thousands of complaints that come in now to 211 and through multiple other things. And so we're trying to increase our ability to sort through those, get to those egregious, willful, blatant violators, and take appropriate action. Because those individuals that are doing that are the ones that are holding back the other businesses who are doing everything right, who are following the rules and want to stay open safely. And so we are doing everything that we believe we can to try and increase compliance in an effort to get us through this.
Okay, next question.
Morgan Cook, San Diego Union Tribune. Please state your question.
Hi, I see that there were, among the recent outbreaks, that there were outbreaks at a nail salon and a gym. Were those businesses or any other businesses aside from this gym in Pacific Beach where recent outbreaks happened, were they operating indoors in violation of the public health order at the time? Any of the businesses where the outbreaks happened?
Okay, Dr. Wooten will respond.
Thank you again. I don't have the data in front of me as to whether they were indoors or outdoors. Some of the restaurants may have, and some of the others most likely were previously indoors. When we confirm an outbreak, it may start maybe 3 or 4 weeks earlier with the very first case. And as we get additional cases, and then it then equals 3, that's when we have an outbreak team deployed to the facility and the outbreak is confirmed. So I would tell you that most of the outbreaks, because we have not been operating outdoors for a very long time, most of these outbreaks started before we made those changes for our various businesses.
We have one final call in.
This one's Derek Stahl with Channel 10. Please state your question.
Yeah, Derek with ABC 10 News. I have another question about enforcement, and this is directed to, if I could, Supervisor Fletcher. So I've been speaking with law enforcement about some of the challenges of enforcing the county order, and I've been looking at some of the data for citations as well. And when you look at the data for San Diego Police, the vast, overwhelming 95+% of the number of citations they issued were in April and in May. And part of that, they said, has to do with sort of the simplicity of the orders at the time. At that time, you couldn't be at the beach, you couldn't be at the park, it was black and white. And they say as the health order changed and got more nuanced, it became harder to enforce. And when you look at the data, basically since June in San Diego, citations have virtually stopped. And there was maybe 1 or 2 compared to the 165 they issued before. So the question is, are the enhanced enforcement measures that you guys are announcing today an acknowledgement that local police are having trouble enforcing the health orders because of the complexity and they need additional support?
Okay, Supervisor Fletcher.
Thank you for that question. We routinely communicate with law enforcement around the orders, around what would make it easier for them to enforce. In particular, things around the hour restrictions in restaurants or things that specifically they said would ease their level of enforcement. And so public health orders do change, as do the rest of the laws that they enforce. And I have confidence that they're able to interpret them and appropriately enforce them, but I can certainly follow up with the San Diego Police Department chief to see if there's any ambiguity or concern. I think what we are looking for is as a community to just see a broader focus around enforcement. And we can't control what an individual law enforcement agency chooses as their posture as it relates to enforcement. We can only control what we're doing. And what we are doing is stepping up our efforts to be able to provide greater enforcement, particularly for those egregious, blatant, and willful violators. But we will continue to communicate with law enforcement and see if there's any uncertainty or ambiguity in the orders that are issued.
Thank you.
Okay, I have 2 questions from Mike McKinnon at KUSI. Is the City of San Diego's efforts to bring back tourism while case numbers rise premature?
I'm unaware of what the city of San Diego is doing, so it'd be inappropriate to comment on it.
Okay, a second question, and I believe this is for Dr. Wooten. Do you think the governor should allow people to get their hair cut or nails done inside if they wear a mask?
So, the evidence shows that activities that occur inside, there's a greater risk of transmission. That's why when the various businesses were closed, there was the support to continue these businesses outside. So changes are made, both at the state and the local level, based again on the evidence, and that's what the evidence shows. So that's where we are today, and for opening up of these various businesses, we will rely on the governor's guidance as the various metrics improve, and that's what's going to get us back inside and operating in the current status of using social distancing, facial coverings, sanitation, and hygiene. Thank you.
This next question deals with our contract tracing and investigation, and Nick Mascione, the director of our Health and Human Services Agency, is going to respond.
Okay, this question is from Claire Tragesser at KPBS. How many case investigators and contact tracers are currently employed by the county, and how many are you planning to hire?
Let me answer that in three parts, Claire. First, we have 614 full-time staff that are doing all of our tracing as part of T3. We have 270 investigators. These are people doing outbreaks, and they're doing case investigations. We have 232 contact tracers that are following up from the disease investigation, and about 66 are the support, remaining are support staff. We have currently hired and in training 253 staff. And of that, 48 are case investigators, about 165 are contact tracers. And with that, we're looking to hire an additional 160, about 160 more contact tracers and disease investigators. So we are growing significantly. In addition to that, next week, we are launching our partnership with San Diego State with our community health outreach workers. These are contact tracers working with us, our promotoras. They're really based in the community. We'll have 30 initially next week, and they'll be a great augmentation to us, to our team. And then most recently, we did a procurement, and we are bringing on board South Bay Community Services and Project Concern International that are also augmenting contact tracing. We are still seeking other ways and working with our partners to even do more expansion of that contact tracing, so we'll be discussing more in the weeks to come.
This next question deals with outbreaks in businesses, and Dr. Wooten will respond.
These questions are from Abby Alford at CBS 8. Are outbreaks in businesses traced back to employees or customers? Is there a trend in types of businesses? Where there are outbreaks in businesses, are employers not notifying employees? If so, what type of businesses are doing this? Is this a reason for the new order requiring employers, to notify employees of COVID-19 cases?
So thank you for that question. Yet again, the opportunity to clarify our case investigation process. So before COVID-19, our case investigators wore two hats. They would conduct the case investigation, and if any of those cases were associated with outbreaks, they would also do the pre-outbreak work to monitor those cases that are associated with a particular entity. And in this case, the entities, all of them are businesses, whether it's a food manufacturing process or a salon or a restaurant, they're all businesses. Luckily, through our relationship with the Department of Environmental Health in the Luge business group of the county, they would take the food outbreaks or complaints. The others, our epidemiology staff would work through. So, but just even backing up there, any case that's associated with a business, that business gets a letter and it states that an individual in your, an employee in your employment has tested positive, and we provide them with information, and they can use the information in that letter to also send out to their employees. If there is an outbreak, SNFs is an excellent example. We deploy an assessment team to the location to look at what's going on, if there can be improvement in the sanitation, social distancing, and facial coverings. We've done that also with food processing locations. So that is what we, to date, have been doing with COVID-19. And again, as has been described, because our outbreaks are increasing, we are having and need to bring on additional staff so that we can complete all of our case investigations and have separate staff to now focus on the pre-outbreak and outbreak work that's aside from food inspections at various restaurants. That's what, and also to work on the complaints that might fall into one of those two egregious or outbreak situations. And that's what will be taken to our Board of Supervisors on Tuesday. And hopefully, if approved, we will implement phased-in approaches of what we will do to help improve our compliance.
Nelly Cervantes, El Imparcial Tijuana. There are some businesses looking to hire, but not everyone is doing the Zoom virtual interview thing. Hamul Casino just had a hiring happy hour event yesterday in an indoor setting, so several people I know decided not to attend. Is there a way the county could suggest companies do not hold mass job fairs in indoor settings?
Well, there's already a health officer's order that says no gatherings. There are numerous creative and innovative ways that events can be held through a virtual process. So again, that's a tip that you could email to us so that we could further investigate, but we are not recommending gatherings of any kind other than what's already allowed, say going to a restaurant for a dinner based on the guidance that we have to date received from the state.
Well, that concludes our calls for today. Let me remind everyone that, again, we will not have a scheduled briefing until next Monday at 2:30. But as always, we will have email updates that will be available for the media, and they can check our coronavirus website for data and any updates. It's going to be a long, hot weekend, so please remember that our Cool Zones program is operating in selected locations. For information on that, please go to coolzones.org or call the County Aging and Independent Services Center at 1-800-339-4661. Thank you, and stay safe, San Diego.